Today we're going to be reviewing some of the major medicines that you'll be taking in life after transplant. As part of our transplant team, when we include our patients as part of our team, we're going to ask that you always keep an updated list of your medicines with you. We also want you to take your medications as directed and try not to skip around or miss doses of your medicines. We understand that life happens and that you may miss some doses of your medicines. Please try to take your medications as soon as you do remember to take it. However, if it is closer to the time of the next dose, please skip that dose or else contact your coordinator or your team to be directed. If you do vomit as you take your medicines, please contact your coordinator or the pharmacist and we'll help direct you about what to do. Please report any side effects that you may be having with the medication so we can help coordinate with our team to figure out what would best serve you with these side effects. Please keep your medications in the original containers as dispensed from the pharmacy. However, if you do use pill box, and we do like it when our patients use pill box, it's okay to store your medicines in the pill box as you take them for the week. As with all medications, please keep them out of reach of children and animals. Please store your medicines in a cool, dry place so that way they can stay intact and safe. With regards to over-the-counter medicines, please contact your transplant team before you do take any of these medicines. There are multiple drug interactions with over-the-counter meds, and so to just err on the side of safety, we ask that you check with us before you take these medicines. Please do not take herbal supplements. They have not been well studied with regards to their drug interactions, so as a general statement to our transplant patients, we do ask that you avoid the use of herbals in life after transplant. Not taking your medications properly is one of the major reasons for transplant failures. We ask that our patients be as compliant and as precise as they can with their medications in life after transplant. We're now going to discuss some of the anti-rejection medicines or immunosuppressants that you may be taking after transplant. The first one that we're going to talk about is called Prograf. The generic name for Prograf is tacrolimus. I make a point of telling you the generic because most likely after you go home from transplant you will be taking the generics. We are okay with the use of generic medications for your immunosuppressive therapies. We do ask though that whatever pharmacy it is that you're getting your anti-rejection medicines from, that they give you the same type of generic on your immunosuppressives each time. There can be very small differences between the way one company makes it versus another company, so to avoid those differences, we do ask that your pharmacy dispenses the same type of generic on the medicines. Now your Prograf is so important to us that every time you come to clinic, we're going to draw your blood. One, we want to see how it is that your liver is doing, but two, we also want to measure how much Prograf is in your body. Based upon that drug level, the dose of the Prograf does change up quite frequently. Some of the major side effects that you may experience with Prograf early on is that it may cause headaches and hand tremors. This does not happen to every single transplant patient, but if you were to notice that you were getting daily headaches or your hands were a little bit shaky, I would probably blame it on the Prograf. Now, as your body gets used to the medicine, much of the time the headaches and hand tremors will disappear. However, for a small group of patients, the headaches and tremors can persist and even worsen. So if you find that this is happening, please let us know. It could be a sign that your Prograf level has gotten higher than what it needs to be, or you may be one of our patients who's a bit sensitive to the medicine, in which case we may have to change you over to something else. Another immunosuppressive therapy that you could be on is called Cellcept. The generic for Cellcept is mycophenolate mofetil. Now usually when you go home, we write for the 250 milligram capsule, and depending upon what's going on with your liver and what's going on with your other medicines, you could be taking anywhere between 500 to 1,000 milligrams of Cellcept twice a day. Now, unlike the Prograf, the dose of the Cellcept stays pretty standard. We only really start to change the dose around if you start to have some side effects from it. Some of the major side effects that I like for our patients to know about with Cellcept is that it may cause nausea, vomiting, and diarrhea. So if you find that you are so ill or so nauseated that it's hard for you to keep down food, fluids, or your medicines, please contact us. Or if you're having multiple loose bowel movements a day, I'm talking 5, 6, 7 loose bowel movements a day, again, that's a reason to contact the transplant team. These type of stomach issues could be related to the use of Cellcept, or you may have picked up a stomach virus or some other illness, in which case the transplant team would have to explore why it was that you weren't feeling well. Another anti-rejection medicine that you'll be taking after transplant is called Prednisone. For our liver transplant recipients, you will actually not be on Prednisone forever. Most of our patients are on a Prednisone taper, which could last anywhere between 1 to 3 months after transplant. With the high doses of Prednisone that we give you in the hospital, there may be some side effects which you could experience, including night sweats, irritability, and some odd dreams. Now, these types of side effects should dissipate as we come down on the Prednisone dose. Now, you may have heard that prednisone may cause issues like weight gain, weak bones, cataracts, and so on. But generally, with our liver transplants, we don't see these types of side effects because you are on prednisone for a relatively short amount of time. If you are not tolerating things like the Prograf, CellCept, and prednisone well, there are alternative immunosuppressive therapies called Neural or Rapamycin, which we may place you on. The first one is called Neural, and like the Prograf, it has the generic. The generic for Neural is called cyclosporin. Similar to the Prograf, how much Neural it is that we give you really depends upon how much is in your body. So again, every time you come to clinic, we're going to draw your blood to see how your liver is doing, but also to check the amount of cyclosporin that it is in your body. Some of the side effects that you may have with Neural is that it may cause some increases in your blood pressure, it may cause some elevations in cholesterol, and for some patients it may cause gum bleeding. Another immunosuppressive agent which you could be on is called Rapamycin or sirolimus. Rapamycin can be used in place of or together with Prograf. Similar to the Neural and the Prograf that we talked about, your Rapamycin dose is really going to be level dependent. Now, unlike those two other medicines, Rapamycin is generally given just once a day. Some of the side effects that Rapamycin may cause is it may cause an elevation in your cholesterol, especially your triglycerides. It may cause some decreases in your blood counts, such as anemia, and it may cause some mouth ulcers or rashes. Again, like all the other anti-rejection medicines, we'll be monitoring you carefully to make sure that you are not having these side effects. These anti-rejection medicines are very good at doing what it is that we intend for them to do, which is to decrease your risk of rejection. The downside about being on these types of therapies, though, is now your immune system is much weaker than what it was before. So the next group of medicines are what I call our prevention medicines. We're going to try to prevent you from getting some of the common illnesses that transplant patients can be vulnerable to. The first one that we're going to discuss is called Bactrim. Now, Bactrim is an antibiotic that has been around for many, many years. We use it for lots of different reasons, but for you, we are using it to help prevent a certain type of pneumonia called PCP. PCP is an organism that we find in our environment. We breathe it in, we breathe it out. But for a transplant patient, if you were to get that into your lungs, it could cause a very serious lung infection. So we're going to use the Bactrim to try to prevent that bug from getting into your lungs. Generally, we have our liver transplant patients take the Bactrim until their 3-month transplant anniversary. You don't have to memorize that stop date. We'll help remind you about when it's time to stop the Bactrim. Some of the side effects that you may experience with Bactrim is that it may cause rashes and sun sensitivity. And by sun sensitivity, I just mean it's going to be very easy for you to get sunburns while you're taking this medicine. So while you're on the Bactrim, we do recommend that our patients wear a hat and some sunscreen if they're going to be outside for an extended time period. Now, if you do happen to have an allergy to sulfa-type medicines, there are alternatives that we can use in place of the Bactrim. Another prevention medicine that you could be taking after transplant is called Valcyte. Valcyte is to help prevent a certain type of virus called CMV, or cytomegalovirus. Now, by the time most of us are adults, we've already been exposed to CMV. And once we've been exposed to CMV, the virus stays sleeping or latent in our body. For our transplant patients, though, sometimes with all the anti-rejection medicines that we give you, it gives that virus a chance to wake up and cause an active infection. So what we're going to try to do with the Valcyte is we're going to try to keep that virus in its sleeping form. Now, depending upon whether or not you've ever been exposed to CMV, the course of your Valcyte therapy could be anywhere between 3 to 6 months after transplant. We'll help let you know at the time of transplant and at the time of discharge how long it is that you'll be on the Valcyte. Some of the side effects that you may experience with Valcyte is that it may cause some decreases in your blood counts. You may not necessarily feel this, but we'll watch your laboratory work for it very carefully to make sure that this is not happening. Now, another prevention medicine that you'll be taking after transplant is called nystatin. We have you on nystatin to help prevent thrush infections. Thrush is a yeast infection that can occur in your mouth, and it's related to the use of high-dose prednisone when you're immediately post-transplant. It's anticipated that by the time you go home after transplant, your prednisone dose will be low enough that your risk of developing thrush will be quite low. Hence, you probably will not be sent home on nystatin. Instead, it's just a medicine that you'll be using here in the hospital. Nexium is a medicine that you'll be taking to help prevent stomach ulcers or to reduce the acid that your stomach makes. We think that this is particularly important in life after transplant because some of the other medicines, like the CellCept and Prednisone, can be very irritating to your stomach. When you go home, it could be on Nexium or it could be on one of its other cousins in this class, including Protonix, Prevacid, Acifex, Omeprazole. They all do the same thing, which is to reduce the acid that your stomach makes. Now, if you don't have a history of heartburn or reflux, we're usually able to stop this medicine within 1 to 2 months after transplant. Urso Forte is a medicine that you'll be taking after transplant to help thin down the bile that the liver makes. Now you may read somewhere that it's to help prevent gallstones and wonder why it is that you're taking it, because we usually remove the gallbladder at the time of transplant. We're actually not using it to help prevent gallstones. Again, it's just to help thin down the bile that the liver makes so it flows easily out of the liver and doesn't cause a lot of congestion. Your usual dose of the Urso Forte will usually be 500 milligrams twice a day. Similar to some of the other prevention medicines, this is not a forever medicine. As long as your bilirubin levels are normal within 1 to 3 months after transplant, we're usually able to stop this medicine at that time. A baby aspirin may be prescribed for you after transplant. It used to be that every single one of our liver transplant patients would get started on a baby aspirin, but we now take it on a case-by-case basis. If you were taking a baby aspirin before transplant, we will resume it after transplant. However, if this is a new medicine for you, it's because it's been assessed by the surgeon and thought that you would need a little bit of aspirin to help thin down the blood so that it flows easily to the liver. A multivitamin is something that we would like for our transplant patients to take until they're back to eating their normal healthy diet. Once this happens, you may stop the multivitamin. You can purchase any over-the-counter multivitamin that you would like, whether it be a Centrum, a Theragrain, a Flintstones chewable, whatever it is that you find tasty or tolerable. Again, once you're back to eating your normal healthy diet, you can stop that multivitamin. Please remember though that whatever multivitamin it is that you purchase, that it should not contain any herbal products. Again, we do not want our transplant patients taking herbals in life after transplant. The rest of your medicine list will be comprised of your home medications. So medicines that you were using previously to treat your blood pressure, cholesterol, and other disease states will be resumed. What will be stopped in life after transplant were the medicines that we're using to treat your liver disease. So no more lactulose, no more Xifaxan, and hopefully no more diuretics, as your brand new liver will take care of dealing with these problems. Thank you so much for your time. Please know that we are always available for any questions that you may have about your transplant medicines. Before you go home after transplant, we'll review all of these medicines again, and we'll help make sure that you understand how to take your medicines properly after your liver transplant.